welcome everyone to our ongoing course series on what we've been calling resistance medicine. It includes action, street, protest, and riot medicine, as well as herbalism for activism, which is part of an umbrella series of courses that we call crisis preparedness, which prepares people for both acute and long-term crisis and instability in their communities. We've been teaching these classes since 2014. We keep updating and changing them as new information comes available, as new people join our nonprofit organization, but it's been a long series, and recently we've partnered with RUMA to teach between 3 and 4 classes there a month, generally one of which is actually digital. Today is a digital only one, and we are focusing on the prevention and treatment of respiratory illnesses. Specifically, we're going to focus on respiratory viruses in this class because we are heading into the season for respiratory viruses. This class is designed for herbalists and medics, not for medical professionals. Not that medical professionals can't attend this class. It contains a lot of information that anyone who wants to make use of complementary treatments alongside allopathic treatments might find very useful, and so it's open to everyone, but it is designed specifically for herbalists and medics. We can't diagnose or treat or claim to cure anything, but we're going to talk about what's verifiable in prevention and treatment in terms of food, supplements, and herbs. Now, before I get into that, let me just remind you all what we are. Sanctum of the Craft is an anarcho-socialist witchcraft collective. We are also an online seminary and church of witchcraft. You do not have to be a witch to make use of any of our content. We welcome people of all spiritualities, religions, from completely atheist and agnostic to deeply spiritual. And we don't care if you don't like us being witches, as long as you can be respectful of everyone who's present. You're welcome here. I am a medic and herbalist myself. I have been an herbalist for decades now, and this is based in my research, and all of my sources are available at not all of my sources, a lot of my sources are available in the bibliography at the bottom of the notes. Speaking of the notes, I'm going to give them to you all now. You want to get it? Yeah. Okay. The notes are about 34 pages long. We're going to get through as many of them as possible, which brings me to my next point. I only have slides for half my class. I am recovering from a surgery that I had done yesterday. I thought someone else was going to be able to take the slides, and they weren't. They let me know last minute that they were not available and actually had to leave town. And so I got to try and make the slides while recovering from surgery today, and I only got halfway through. So we have complete notes, but halfway through we're going to have to switch to just lecture format, which brings me to the question, do you all even want half of the class in slides, or would you prefer to just do it as a lecture? Because the slides are going to stop halfway through. Alright, if nobody says
I think you worked really hard on at least half of the slides. I would love to see them.
Sure, we'll do slides. While I made them while drugged and pretty out of it, so we'll see how I did. There's a reason I'm not normally the person who makes the slides. Okay, let's go ahead and do the screen sharing and switch over to the slides. Is that as it should be, Ian?
Yes.
Excellent. So, humans have been using plant-based medicines to treat sicknesses and diseases since before there was written language. In the modern day, plant-based medicine can take the form of ingestion of a whole or part of the plant, taking an infusion or extract, or making use of an isolated phytochemical. Phytochemicals are naturally occurring chemical compounds found in plants, which may be either primary or secondary metabolites. We have a whole class several classes on primary and secondary metabolites. I'm not going to get into that now. Some of the isolated phytochemicals in use right now for the treatment of someone who is sick with a respiratory ailment, common cold, influenza, respiratory syncytial virus, COVID-19, etc., include salicylic acid, which is isolated from willow trees, and quercetin. I'm going to get into both of those. Some natural products have been tested in clinical setting and demonstrated significant efficacy in the treatment of acute and chronic disorders of the lungs. This class is going to focus on viral respiratory infections, which are amongst the most common human illnesses. These include the common cold, rhinovirus, acute bronchitis, influenza, COVID-19, and respiratory syncytial virus. While some of the common respiratory viruses have effective vaccines that are available and recommended for use each year, they have unfortunately low levels of uptake in the general population of the United States. Some plant-based materials are used in preventative medicine, which aims to prevent a person from being infected by a respiratory virus at all, or which aims to reduce the severity and longevity of a respiratory virus if a person becomes infected at some point. Some conventional treatments, plant-based or otherwise, for respiratory problems are symptomatic. Symptomatic treatment provides relief from illness symptoms, but does not address the underlying cause, such as taking a cough suppressant for a cough caused by a virus. Doesn't kill the virus, but it helps with the cough. Some conventional treatments, plant-based or otherwise, are curative. Curative treatments attempts to eliminate the condition, ailment, syndrome, disorder, or disease and promote recovery. This would be like taking an antiviral for a respiratory virus. The administration of plant-based medicine may be through ingestion of as a regular part of a diet, ingestion via medicine. This would be hot water infusion, tincture, cough syrup, drops, capsules, topical application, inhalation of steam, application of a salve, or an injection. Far more common with isolated phytochemicals in an allopathic medical setting. I really don't train any of my students in doing injections of herbal medicine because it's kind of beyond the scope of herbalism and street medicine, but there are herbalists who do, and there are exceptions that, especially when I'm teaching midwifery schools or skills. Yeah. Okay. I want to note here that this class is going to go into all of these as a form of applying an herbal medicine for respiratory viruses. We're going to get into all of these different forms of giving someone that. It's important to remember several things. This class is intended to teach herbalists and medics who do not have the legal or ethical right to diagnose or claim to treat, cure, or prevent any sickness, condition, ailment, disorder, or disease. Just because there are plant-based medicines does not mean that they are automatically safe. All the plant-based medicines that follow have contraindications, adverse effects, and side effects. Any action a plant has on the body is contraindicated for someone. Can any of you give me an example, you can do it in text, of a desired effect that a plant could have for one person that would be an undesirable effect that a plant could have for someone else? Well, Ian's raising his hand off camera, but he's been my student for a long time, so that doesn't count. Anybody? Crickets. All right.
Yeah, that's a good one.
Oh, well said. Good one. Abortive. If something is an abortifacient plant, that might be very desirable for one person and completely undesirable for another person. Another example would be something that is a hypotensive, that lowers blood pressure. One person might be like, oh yeah, sign me up, I really need to lower my blood pressure. And another person would be like, oh no, I already have low blood pressure, I shouldn't take that. Or I'm on a medication that causes low blood pressure, I shouldn't have that additive effect. When a plant does not have easy to find contraindications online, one way that you can figure out its contraindications is to look at its actions and say, well, this action is indicated for some people and contraindicated for other people. All right, we're getting into prevention, and we're starting with the one that I'm sure everybody has heard, and I'm sure I'm preaching to the choir, but I have to address it. Hand hygiene. Hand hygiene is simple, low cost, and contributes to substantial effects at suppressing acute respiratory infection epidemics. Hand washing is especially indicated for COVID-19 and influenza, as they are enveloped viruses, which means they are surrounded by a viral envelope made of lipids, which protects the virus when it's outside of a host cell and anchors the different structural proteins needed by the virus to infect the cells. This envelope is best destroyed by a combination of friction, soap, and water. Hand sanitizer is also effective against both, as it also destroys the envelope. The question of when and how often the public should wash their hands to affect infection risk still has not been authoritatively answered. This is something that is debated. There was a meta-regression analysis that was performed that found that a single hand hygiene event, washing with soap and water or using hand sanitizer, decreased the daily probability of an acute respiratory infection by 3%. That's one single hand washing. But that review had... Yeah. No, it wasn't intentional to switch to sharing them. Oops. It wasn't a super well done review or study, so that's why it's not on the slides. And it's clear that there is a dose-response relationship between hand hygiene frequency and decreased rate of infections. At least one study has found that the benefits of hand hygiene do not maximize by washing one's hands every hour. You can't just say, well, I'll wash my hands every single hour and then I'll never get sick. It doesn't work. There is a complex relationship between hand washing and risk of infection, partially due to the fact that not all viruses last on the hands the same amount of time. Some viruses do not last on the hands for very long, so washing one's hands once in the middle of the day may not affect transmission risk at all. Droplets of respiratory secretions containing influenza only last on human fingertips for about 5 minutes. It may be better to tell people to wash their hands if they feel they may have been exposed to a virus or bacteria. This would include after any kind of exposure to someone with symptoms, or after touching contaminated surfaces, after handling raw meat, etc. I'll have more examples here in a minute. Additionally, people often do not wash their hands correctly. Even people who self-reported that they wash their hands frequently, at least 4 times a day, or after touching a contaminated surface, about 2/3 of people, during outbreaks of respiratory viruses, may not have done so correctly, thus influencing the data on whether hand washing is effective at reducing infection risk. Only about 5% of people wash their hand for the recommended 20 seconds. Less than half of all Americans use soap when they wash their hands. Only 66% of Americans wash their hands after using the restroom at all, with only 60% of self-identified men saying they wash their hands after using the restroom. If everyone correctly washed their hands multiple times a day, an estimated 1 million deaths could be prevented a year. How many of you have been in a bathroom and watched someone walk up to the sink, stick their fingertips in under the water, and go like this? Yeah. That is self-reported hand washing. That is a person who says, I wash my hands after I use the restroom. If you ask someone, do you wash your hands after you use the restroom? That alone counts. So it's not just, are they washing their hands? It's, are they washing their hands correctly? Hands should be washed before, during, and after preparing food, before and after eating food, after being exposed to someone with the signs and symptoms of illness, after being in an environment with a sick person where surfaces were touched, before caring for someone who is sick, before and after treating a wound, after using the toilet, after changing diapers or cleaning up after a person who has used the toilet, after cleaning the toilet, after cleaning the kitchen, after cleaning up pet feces, after touching animals, after touching garbage, after touching surfaces in crowded environments, schools, malls, shopping centers, etc. Hands should be wet with clean running water. Warm or cold doesn't matter. The tap should actually get turned off, or your fingers should not be under it. The person should apply soap and lather by rubbing the backs of their hands, their palms, between their fingers, under their nails, and up to their wrists for a minimum of 20 seconds. Mentally singing the happy birthday song twice can time this out. They should then rinse their hands with clean running water. They should dry their hands using a towel, never an air dryer. Air dryers spread bacteria and viruses. They make viral outbreaks worse. They contain fecal bacteria. It blows all over your hands when you use them. If a person cannot wash their hands, they can use alcohol-based hand sanitizer that contains at least 60% alcohol. Wearing a mask, of course, can lower the transmission of respiratory viruses in community settings, especially influenza and COVID-19. Unfortunately, using a mask within a family group 1 to 3 days after someone has become infected with the respiratory virus did not appear to prevent transmission to family members, whether or not the masks were worn by the sick person, the healthy family members, or both. Generally, by the time a family member is showing symptoms and it's been recognized that they have a respiratory virus, everyone in the family has already been exposed. I don't know that I would then say don't bother, but that is what a study found. N95 masks have been found to be superior to cloth and surgical masks, both at preventing viral respiratory tract infections from transmitting. Okay, we're going to get into diet next. And I basically can get us all the way through diet with slides, and then we're going to get into herbs and not have slides. There is a direct relationship between nutritional status and immune response to viral respiratory infections. Malnutrition suppresses the immune response and increases the susceptibility to infections. Food choices do affect how the body responds to viruses. Food choices may not prevent someone from becoming infected, but they can impact the length and severity of infections, and there is ever more research that they actually do, our food choices do impact whether we get infected or not. And I'm going to be getting into the research on that basically right now. Inflammation is a critical part of how respiratory viruses impact a person's body, especially COVID-19. The release of inflammatory cytokines can cause what is referred to as a cytokine storm, an immune dysregulation that is a life-threatening complication associated with an increased risk of acute respiratory distress syndrome, which is called ARDS. The damage the virus causes is exacerbated by this inflammatory immune response, which can damage or destroy organs, including the lungs, kidneys, heart, and liver. Inhibition of pro-inflammatory cytokines may be a vital strategy to save the life of those who are affected by COVID-19. It is important for the immune response to be balanced, present to protect the body from foreign microbes, but not overly aggressive and inflammatory. The standard model of American life consists of a very unhealthy amount of sleep, deprivation, stress, and an inadequate, unbalanced diet that does not contain the proper amount of macro and micronutrients. Most Americans exist in a chronic low inflammation status, which negatively impacts the immune systems. Threat to food security, like poor socioeconomic status, directly impacts the spread and severity of disease in our communities. I want to note here that people who belong to socioeconomically challenged communities where they are not getting adequate food are at much higher risk not only of catching respiratory viruses, but also having them last longer and affect them worse. And there are multiple factors that go into that. It's not just diet, it's also lack of sleep. It's also stress. It's also not being able to go to the doctor at the first sign of symptoms. It's also not necessarily being able to pursue medical treatment that you need to correct comorbidities that make infection more dangerous. There are many, many reasons why being socioeconomically challenged makes respiratory viruses hit a community harder. Food is just one of them, but one of the ways that we as people engaged in collective action and mutual aid can support our communities is by trying to get adequate nutrition into our communities, participating in things like food drives, community food outreach programs, community dinners, that kind of thing. I'm going to talk about what those community dinners should look like if you're trying to prevent respiratory spread in your community. Anti-inflammatory diets are associated with helping the body to prevent and combat infections and modulate the severity and duration of infection. Infection can also worsen nutrition, with malnutrition caused by the infection, then decreasing resistance to the infection in a vicious cycle. You may have experienced this vicious cycle yourself at some point. Infections induce inflammation, which generates fever, appetite loss, and alters intestinal absorption. The body then doesn't get the fuel it needs to fight infection, as the sickness induces or worsens malnutrition. That malnutrition that increases the risk of infection spreading in the body, partially due to reduced gut barrier function and the modification of the microbiome. That then compromises immune cell generation and activation and alters the body's inflammatory response, which makes the appetite loss and intestinal absorption worse, and so on in a circle. This is a vicious circle of malnutrition, infection, inflammation, appetite loss, and it will just go in circles, making someone sicker and sicker and sicker as their body does not have the fuel to fight the infection. How might you prevent this vicious cycle from being so bad in the first place? Yeah, anybody? You could do your best, possibly, to eat a diet that addresses malnutrition in advance of getting sick. Preventatively. Starvation diets also increase the risk of respiratory tract infections and their severity. Undernutrition alters immune response and also increases the secretion of inflammatory cytokines, as well as increasing the production of stress hormones such as cortisol, which limit the ability of immune cells to respond appropriately to infection. Fighting infection creates high metabolic need, meaning that the body has to have fuel to fight. If the fuel is restricted, the fight is compromised. Some studies may even suggest that malnutrition may facilitate the development of variants of respiratory viruses that are more contagious and more deadly. You have an undernourished and malnourished community that becomes a breeding ground for variants of respiratory viruses. But there's one thing that I could convey in just right now in this class. It's feed your communities and feed yourselves. So many medics that I've worked with do not adequately fuel themselves for the work. And I'm seeing an uptick right now on social media of really pushing starvation diets, especially on TikTok, and that's coming out of the community that claims it's the herbalism community, claims it's the, support your communities, but what they're actually pushing is starvation diets. And I'm very disturbed to watch that, especially on TikTok. Okay, continuing on. Undernourished children have the highest risk of severe disease from respiratory tract infections. Severe medical obesity also increases the risk of acute respiratory distress syndrome. Please note that I am not saying being fat increases your chance of getting acute respiratory distress syndrome. I mean being in severe medical obesity that is putting strain on organs, not being above the white supremacist BMI ideal for your height. People who are undernourished, malnourished, and who are severely medically obese are more susceptible to severe forms of COVID-19. People with hypertension and type 2 diabetes are also more likely to suffer from critical complications from COVID-19, and both of those conditions are influenced by diet. Not caused, influenced. One reason the elderly are so impacted by respiratory viruses is that they are often malnourished. The elders of our community are often malnourished. They often have to pick between buying food and buying medication. Some foods and dietary patterns have been identified as worsening inflammation, worsening oxidative stress, and worsening the immune system's response to infection. Oxidative stress is an imbalance of free radicals and antioxidants in the body that leads to cell damage, which can damage the immune system. Oxidative stress causes the body to respond poorly to respiratory tract infections, and then respiratory viruses increase oxidative stress marker levels and also impair cellular defense mechanisms against oxidative stressors in another vicious cycle. The foods that cause the worst effects are refined sugars, hydrogenated fats, and ultra-processed foods, and these foods are extremely present in the American diet because often it is all anyone can afford. It's all they can afford, it's all they can access, and it's all they have the time to feed themselves and to feed their families. This class is not meant to be critical of them. It's meant to point out that we are being made sick by not being able to have access to fresh food for our communities. Several diets with anti-inflammatory characteristics have been associated with improved health outcomes for respiratory tract infections. These diets actively protect the body from inflammation, infection, and modulate the severity and duration of infections. The best diets for managing respiratory tract infections and diseases have been found clinically to be the Mediterranean diet, dietary approaches to stop hypertension, and the Harvard Healthy Eating Plate. Looking at what they have in common, they focused on unprocessed and minimally processed food, including fresh produce, fish, and whole grains. What's the problem with all of these diets? Can anybody tell me what the problem is? Somebody said it from off camera, but I don't think anyone can hear him. Anybody tell me what a major problem is with this diet? Food deserts, that's a great one. Yeah, barriers to access. Food deserts, income, the rising cost of food, the tariffs effects on our food prices, the price gouging at the supermarket, whether someone has the time to make this kind of food or if they have to just reach for something they can pop in a microwave. Time, spoons. Micronutrients. Micronutrients play an important role in the immune response to respiratory tract infections. Micronutrients are nutrients required by the body in small amounts to support growth, development, and maintain optimal health. These include vitamins and minerals. Vitamin D is a fat-soluble vitamin that is naturally present in only a few foods. but also produced when ultraviolet rays from the sunlight strike the skin and trigger vitamin D synthesis. Vitamin D supports immune function, muscle strength, brain cell health, cell growth, and it's vital for the absorption of calcium, which is needed for bone health. It's also a potent anti-inflammatory, also has a major role in depression and anxiety, but that's beyond the scope of this class. Recent data shows that over 60% of Americans have insufficient or deficient levels of vitamin D. Vitamin D insufficiency has been associated with greater wheezing in asthma in children and adults. Studies in North America found that supplementation with vitamin D leads to a significant reduction of respiratory tract infections. Supplementation with vitamin D has also been found to make tuberculosis treatment more effective and recovery faster. Low vitamin D levels in winter have been theorized to contribute to the frequency of influenza and rhinovirus outbreaks during that period. Low vitamin D status is associated with so many diseases that dietary supplementation might be a cost-effective measure to improve the general health of any given population, especially in those who cannot get adequate access to sunlight in their daily lives. Who might not get adequate access to sunlight in their daily lives? Could it be the cashier working doubles? Would that be a person who might not get adequate access to sunlight?
Your average office worker.
Your average office worker. Food sources of vitamin D. Few foods are naturally rich in vitamin D, unfortunately. This is one reason supplementation might be necessary. Fungi contain it, especially if they've been fortified with exposure to ultraviolet light, which is a label that you'll see on a package. But you can fortify your own mushrooms. You can actually just spread them out on the counter in the sun, and they will actually fortify themselves after about 45 minutes to an hour. So you don't actually have to buy the more expensive fortified ones. Vitamin D fortified foods, dairy, cereals, orange juice, sunflower oil, it'll always be labeled. A lot of sunflower oil in the United States is vitamin D fortified. Fish, salmon, swordfish, tuna, sardines, and cod liver oil contain the most. Meat, beef liver contains the most, and egg yolks, not egg whites. Vitamin A is an essential fat-soluble nutrient that supports immune function, healthy skin, and mucous membranes and vision. People with vitamin A deficiencies, especially children, are more likely to be infected with respiratory viruses compared with the general population and more likely to develop serious respiratory illnesses, including otitis media, sinusitis, pneumonia, than those with non-recurrent respiratory diseases. Children with low vitamin A levels are more likely to die from respiratory tract infections than children without that malnutrition. Supplementation with high repeated dosage with vitamin A has been found to have a small decrease incident of respiratory tract infections in children, but it appears likely that it's more important to have a diet rich in vitamin A than it is to rely on supplementation because vitamin A is not super bioavailable from supplements. Dietary sources for vitamin A include eggs, dairy products, milk, cheese, yogurt, fish, specifically fatty fish, mackerel, salmon, cod, tuna, liver, beef, chicken, pork, vegetables, spinach, sweet potatoes and carrots, legumes, lentils, black-eyed peas, fruits, mangoes, apricots and cantaloupe, nuts and seeds, pumpkin seeds, and almonds. Vitamin C, also known as ascorbic acid, is an essential water-soluble vitamin that is an antioxidant, supports immune system function, and aids in the absorption of other vital nutrients and micronutrients, including iron. Smokers with a higher dietary vitamin C intake don't cough and wheeze as much as smokers who have a lower intake of vitamin C, which may be due to its potent antioxidant action. Some studies have found that vitamin C supplementation doesn't reduce symptoms of rhinovirus, the common cold infection, while others have found that it does at a dose of a minimum of 80 milligrams daily. So contradictory evidence specifically on whether vitamin C helps with the common cold. Adequate vitamin C levels were essential in preventing COVID-19, as well as in the treatment who have it. Both adequate dietary amounts of vitamin C and supplementation may be helpful. Early intervention in severe COVID-19 cases with intravenous or oral vitamin C at high doses has been used to reduce the severity and duration of infection without observed adverse effects. They just gave it in addition to the medication that you get in a hospital for COVID-19. And it reduced the severity and duration of the infection in the people who got it. Food sources for vitamin C include vegetables, peppers, broccoli, Brussels sprouts, cauliflower, potatoes, tomatoes, spinach, kale, and cabbage, fruits, strawberries, mangoes, lemons, citrus fruits, fortified breakfast cereals, fortified grains, and fortified potato products. Fortified means that it was added to it, by the way, in production. someone along the chain was like, we shall add vitamin C to this because people don't get enough. People say that sugary breakfast cereals serve no purpose, but a lot of them in the United States are actually fortified with a fair amount of vitamins and minerals. Vitamin E is the collective name for a group of fat-soluble compounds. They are all antioxidants that play a role in immune function and are anti-inflammatory. They also serve important roles in nerve and cognitive health, healthy skin and eyes, and absorption of vitamin K. Sufficient levels of vitamin E cause decreased mortality from respiratory disease. One trial performed at elderly nursing home residents found that those who took 200 micrograms of vitamin E daily had a lower incidence of the common cold and contracted fewer upper respiratory tract infections over the course of a year as compared to those who did not. Dietary sources of vitamin E include vegetable oils, wheat germ oil, soy, corn, sunflower, seeds, specifically sunflower, nuts, almonds, hazelnuts, and peanuts, fruits, avocados, mangoes, and kiwis, vegetables, tomatoes, spinach, and broccoli, fortified grains, eggs, and specifically tuna. Iron is a mineral that the body needs for growth, development, and to have a healthy immune system. It also uses iron to make hemoglobin, a protein in red blood cells that carries oxygen from the lungs to the rest of the body, and myoglobin, which provides oxygen to muscles. The body also needs iron in order to make hormones. Iron deficiency is common worldwide, especially amongst disadvantaged socioeconomic classes. Iron deficiency anemia increases the risk and severity of respiratory tract infections, especially in very young children. Iron deficiency makes people more likely to get infections, not just respiratory tract infections, but all infections. Food sources of iron include red meat, beef, pork, and lamb, poultry, chicken and turkey, seafood, oysters, clams, mussels, eggs, legumes, including beans, lentils, and chickpeas, nuts and seeds, cashews, almonds, pumpkin seeds, dark leafy greens, spinach, kale, collard greens, fortified cereals and grains, fruits, raisins, and prunes, molasses, dark chocolate, and fermented foods, including tofu and tempeh. Zinc is an important non-metabolite that is a cofactor for over 200 enzymes in the human body. It plays a direct role in RNA, DNA, and protein synthesis. It is essential for immune function as it is involved in both the development and maintenance of immune cells. It is essential for anabolic and energy metabolism, and it also modulates inflammation. Zinc deficiency in growing humans disrupts their growth. Approximately half of the world's population has a zinc-deficient diet. Severely zinc-deficient individuals will also develop anemia. Zinc supplementation has been shown to have a positive impact on pneumonia and also to reduce the number of common colds that a person has in a year. Food sources of zinc include nuts, cashews and peanuts, seeds, sesame and pumpkin, legumes, chickpeas, lentils and beans, eggs, meat, lamb, red meat and poultry, fish, shellfish, vegetables, dark leafy greens, and dark chocolate. Selenium is an essential non-metabolite that is an essential component of various enzymes and proteins called selenoproteins that help to make DNA and protect against cell damage and infection. A lack of selenium compromises the immune system and also causes the symptoms of iodine deficiency. Too much selenium can also cause selenium poisoning. Of the ones we've covered so far, this one needs that warning. If you take too much, it can really hurt you.
Yeah.
A diet that contains sufficient selenium has been found to cause lower rates of COVID-19 infections as well as less severity and faster recovery from active COVID-19 infections. Supplementation with 50 to 100 micrograms per day as a provisional daily doses has been found to help prevent infection with both influenza and coronaviruses, including the daily selenium recommendation, which is 50 micrograms. So if you are already getting 50 micrograms from your diet, don't then add 100, add 50. Dietary sources of selenium include meat, pork, poultry, and beef, fish, especially yellowfin tuna, but also sardines and shrimp, eggs, dairy, especially cottage cheese. I'm so sorry, I know it's taken over TikTok, but it's in cottage cheese. Whole or enriched grains, some nuts, Brazil nuts especially, but cashews and pistachios to a lesser extent, sorrel, which is a specific plant, and mushrooms. I want to note here that this is why you should never sit down and eat a whole bag of Brazil nuts, because that is too much selenium. You should only have a few. Fatty acids are an important dietary source of fuel for animals and important structural components for cells. Vitamin F is not a traditional vitamin but a term for two fats, alpha-linolenic acid and linoleic acid. It is an essential fatty acid used by the body to build and maintain membrane structures. Human bodies can make almost all of the fatty acids that we need, with exceptions. Omega-3 fatty acids, linoleic acid, linolenic acid, gammalenic acid, cis-6, cis-9, and cis-12 octadecatrienoic acid, I can say it, and omega-6 fatty acids, gamma-linolenic acid. These fatty acids are therefore essential in the diet. Plants can synthesize linoleic and linolenic acid from precursors in their system, so humans need to acquire them by eating plants that contain them or eat meat from animals that have consumed those plant fats themselves. Gamma-linolenic acid is an omega-6 fatty acid that enhances immune system, decreases inflammation, and is essential for neurological function. Alpha-linolenic acid is an omega-3 fatty acid. The metabolites of alpha-linolenic acid may also inhibit the production of pro-inflammatory cytokines. Remember us talking about cytokine storms. A study performed on newborns found that infants who were fed the formula supplemented with 2 fatty acids, docosahexaenoic acid, an omega-3 fatty acid, and arachidonic acid, an omega-6 fatty acid, in the first year of life developed fewer respiratory tract infections. Too much arachidonic acid can be a problem, especially in elderly adults, as it can generate inflammation and cause more inflammatory cytokines. However, in infants and young children, it is more desirable. 2 other studies performed on older children have found that children who have sufficient levels of alpha-linolenic acid, linoleic acid, and icosahexaenoic acid, an omega-3 fatty acid, had reduced rates of infection with respiratory tract viruses. Food sources of gamma-linolenic acid include nuts, seeds, legumes, eggs, and plant oils, blackcurrant oil and evening primrose oil especially. Food sources of alpha-linolenic acid include nuts, seeds, oils, flaxseed oil, linseed oil, legumes, fatty fish, dark green vegetables, and eggs. Supplement sources of alpha-linolenic acid include fish oil supplements. Food sources of docosahexaenoic acid include fatty fish, salmon, mackerel, sardines, tuna, trout, and anchovies, eggs, dairy products, milk, especially from grass-fed cows, and yogurt, marine algae oils called algal oil, chia seeds, and walnuts. Supplement sources of docosahexaenoic acid include fish oil supplements, and food sources of arachidonic acid include meat from beef and chicken, eggs, and full-fat dairy. Food sources of icosapentaenoic acid include oily fish, mackerel, herring, trout, salmon, whitefish, cod, haddock, marine algal oil, eggs from omega-3 enriched chickens, and supplements include fish oil supplements again. Okay. Let's get through flavonoids. Flavonoids are the largest, most common, most diverse group of polyphenolic compounds in the human diet. Flavonoids include more than 6,000 compounds, all of which share a common structure. Flavonoids include chalcones, flavones, flavanols, flavonanols, flavonones, isoflavonoids, isoflavones, flavonthiols, catechins, and anthocyanins. The most common of these are anthocyanins, flavones, and flavanols. Flavonoids are found widely distributed in higher plants, mostly in leaves and flowers. They are water-soluble. The colors of plants are based on what kind of flavonoids they possess. Yellow, orange, blue, and red, and the combinations thereof all come from flavonoids. There are 2 exceptions. I'm not going to get into this right now. The widespread distribution of flavonoids and their tolerability mean that humans who ingest enough produce get a fair amount of them in their diet. There isn't an established minimum recommended intake of flavonoids in the diet. However, there are symptoms of deficiency that are widespread in America due to the American diet being lacking in fresh produce. If you are in the notes, right after this paragraph is a chunk where it basically just lists how many Americans actually get enough fruits, enough vegetables, etc., and it's appalling. I'm not going to get into reciting all of the statistics, but basically, no. Most Americans are not getting adequate amounts of flavonoids in their diets. Flavonoids reduce the incidence and severity of respiratory tract infections because they're antiviral, anti-inflammatory, antioxidant, anti-proliferative, and anti-replicative against viruses. Many flavonoids have been identified as potential inhibitors of COVID-19. These include naringenin, hesperidin, neohesperidin, quercetin, cyanidin, rutin, camphorol, hesperitin, miracetin. I'm not going to recite all of these. For one thing, I'm going to start tripping over my tongue, and I'm going to blame the pain medication that I'm on. Quercetin is one of the ones we're going to go over quite a few times today. It's displayed significant inhibitory activity against COVID-19, especially when co-administered with vitamin C. They can employ it on their own or in combination with standard treatment to improve COVID-19 treatment in high-risk populations. Cyanidin and genistein have a binding effect on COVID-19 compared to the standard drugs nelfinavir and lopinavir. Bicolin was comparably binding to a protein in COVID-19 called the S protein as the drugs abacavir and hydroxychloroquine. Bicolin was also reported to have antiviral activity against other viral infections. As aforementioned, severe cases of COVID-19 are dangerous, partially because of the risk of developing the cytokine storms. Flavonoids are immunomodulatory and anti-inflammatory, and they can help prevent cytokine storms. The most important flavonoids for immunomodulation include naringenin, which exhibits promising immunomodulatory activity that reduces the severity of inflammatory responses. It reduces the amount of inflammatory cytokines as well. Hesperetin, which reduces inflammation, increases protection against acute lung injury, and reduces inflammatory cytokines. And quercetin, which also inhibited airway inflammation, similar to dexamethasone in mouse trials and in humans in clinical trials. Quercetin has been found to reduce oxidative stress, cell death, and fibrosis, a condition where the lungs become permanently scarred and thickened, making it harder to breathe in COVID-19 patients, but also protects the lungs from damage from other causes, such as smoke inhalation. Quercetin also shows a proactive activity against pneumonia, even obstructing pneumonia induced by Streptococcus pneumoniae. Quercetin, of all of the flavonoids, has the highest number of beneficial mechanisms of action against COVID-19, and it's going to come up a fair amount in this class. As stated, flavonoids are diverse. How they are absorbed, distributed in the body, and metabolized influences their efficacy. Different sources are more or less bioavailable. That means we get enough of them when we eat a food, or we don't get enough of them when we eat a food because of their bioavailability. This can hinder oral absorption, but some research is finding that nanoformulations and microemulsions can improve bioavailability in allopathic clinical settings. This isn't as relevant to herbalists or street medics. Like, I can't make a microemulsion of quercetin with the equipment that I have downstairs, but it's still interesting to know and to keep an eye on as we move forward in seeing how this plays out in the medical field. Yellow onions have the highest amount of flavonols, including quercetin, campherol, and myricetin, up to 1.2 grams per kilogram of fresh weight. Curly kale contains up to 0.6 grams of flavonols per kilogram of fresh weight. Leeks, cherry tomatoes, broccoli, and blueberries all contain moderate levels of the same. Leeks, cherry tomatoes, broccoli, and blueberries all contain, I already said that, sorry. The flavones apigenin and luteolin are the most present in parsley, celery, peppers, and black pepper. Flavonones, including hesperidin, naringenin, and aerodictyl, are the most present in tomatoes, oranges, grapefruits, and lemons. And now we get into an effective regimen, possibly. In one study, a combination of quercetin, vitamin C, and bromelain, more on this later in the section on pineapple juice, was given to patients with respiratory tract infections. It increased the bioavailability of quercetin significantly. Both vitamin C and bromelain on their own can improve the oral bioavailability of quercetin by up to 80%. So together, they're really improving the bioavailability of quercetin. The combination showed no adverse effects on the participants and prevented the dysregulation that comes from COVID-19 and can cause cytokine storms. In the trial, this was combined with the standard treatment regimen of hydroxychloroquine, which was 400 milligrams daily for another 5 days, and favipiravir, which was 2 doses of 600 milligrams for 4 days, followed by 2 doses of 1600 milligram loading days on day 1, following a, not followed by. So basically what this says, I'm just going to translate, is that this was tested on people who were in the hospital for COVID-19 and were on the standard treatment regimen, but at risk of developing cytokine storms. So they were given this combination of quercetin, vitamin C, and bromelain, and it reduced the chances of them developing cytokine storms without showing any adverse effects. It didn't impact the standard treatment. I'm going to get into that specific regimen again when we get into dosage and recipes. Multiple studies have found that probiotics in a diet reduce the incidence rate, number of cases per person per year, of respiratory tract infections in children, adults, and the elderly. In the studies, children were more likely to obtain probiotics from consuming dairy products like yogurt, adults were more likely to consume probiotic powders, and elderly people were more likely to get probiotics from dairy sources from capsules and capsules. Adverse effects from probiotics in the study were fairly minor, with some people experiencing some gastrointestinal symptoms like flatulence. In rare cases, they experienced vomiting, diarrhea, and bowel pain and had to reduce or stop taking the probiotics. Dietary sources of probiotics include fermented dairy, kefir, yogurt, some buttermilk, cheese, fermented vegetables, sauerkraut, kimchi, miso, tempeh, fermented yeast, kombucha, and dark chocolate. Fermented kombucha is not made from mushrooms, it's made from yeast. Cranberry juice may also help reduce the frequency of infection and the severity and duration of respiratory tract infections. This is partially due to its high vitamin C content, but it's also due to the presence of proanthocyanins, compounds with antiviral effects against influenza type A and B. It prevents the virus from attaching to cells. It's also due to the presence of anthocyanins, which inhibit the main protease enzyme in SARS-CoV-2. It also reduces inflammatory cytokines and may help prevent cytokine storms. It also reduces all of the symptoms of respiratory tract infections, specifically rhinovirus, influenza A and B, and COVID-19. And that is just the juice, just drinking the juice. Not cranberry juice cocktail, actual cranberry juice. But cranberry supplementation is also important. One study found that ingestion of cranberry supplements significantly improved responses to the standard therapy, which we just went over. At doses of 1,000 milligram capsule, they actually used a specific brand, CranRx by Nature's Way, per day for 7 days. The cranberry supplementation reduced the inflammatory response, relieved overall symptoms of COVID-19, and helped maintain the patient's oxygen levels. Pineapple juice. It is misinformation that pineapple juice is 5 times more effective at treating cough than codeine cough syrup. That is just a viral post that went around Facebook. It's not true. It doesn't work, which is kind of sad. However, it should be noted that codeine cough syrup has also been found to be clinically ineffective in studies on both adults and children. It doesn't actually suppress coughs. It does not help with coughing pain. It shouldn't be in use, but it is, despite the fact that it has been found repeatedly not to work. Pineapple juice may help with coughing due to its anti-inflammatory properties. It can also help with respiratory infections due to its antimicrobial and immune-stimulating properties. Pineapple juice contains the protease enzyme bromelain, which is only found in pineapples. It exhibits a major effect on reducing mucus, which can also help reduce the severity of some respiratory tract infections and possibly prevent pneumonia. There has been a study that found that both honey on its own and honey combined with bromelain showed immediate improvement in coughs. Taking bromelain orally can improve breathing, lessen congestion, lessen coughing, and support recovery from infections such as COVID-19, but that's as an isolated supplement, not as pineapple juice. However, pineapple juice has been found anecdotally to be very soothing on people's throats, and its high vitamin C content is also likely to be beneficial. The research doesn't undermine the experience of those who have personally found pineapple juice helpful in relieving a cough. It just means that further research is needed to prove whether or not it is effective or whether it should be isolated bromelain that is used. Bromelain is also a very effective oral painkiller. Bromelain was comparable to diclofenac in the management of post-operative pain, swelling, and jaw spasm following impacted mandibular third molar surgery. Diclofenac is a non-steroidal anti-inflammatory drug that's used to treat mild to moderate pain. Supplementing with bromelain and curcumin, isolated from turmeric, can interfere with the key phases of the pathophysiology of COVID-19. Bromelain should not be taken by people who are allergic to pineapple or latex or things in the daisy family, including ragweed, echinacea, chrysanthemums, marigolds, daisies, or by people with allergies to wheat, celery, carrot, fennel, cypress pollen, or grass pollen. It also slows blood clotting, so it should not be used by people with clotting disorders or who are on blood thinners or before surgery. Multiple studies have found that turmeric has a relaxant effect on the smooth muscles of the trachea, a bronchodilatory effect on patients with obstructive pulmonary disease, and a preventative effect on respiratory diseases. It is extremely anti-inflammatory and immunomodulatory, but also influences pathological responses in the lungs, keeping airways more open and more responsive. Intriguingly, this effect is caused both by the plant itself and its major constituent, curcumin, in isolated form. Both turmeric and curcumin show major relieving and preventative effects on respiratory disorders. The isolated curcumin has been found to prevent the entry of SARS-CoV-2 into human cells. 6 studies have found that curcumin supplementation during COVID-19 infections led to a significant decrease in common symptoms, duration of hospitalization, and deaths. And all the studies found that using curcumin supplements ameliorated the cytokine storm effect. Another study found that combining bromelain with curcumin improved endothelial cell function, oxygen utility capacity, and fatigue in adults and caused only minor side effects. Curcumin is effective on its own, according to these studies, but other studies have found that it has a fairly low bioavailability on its own. Bioavailability limits its practical application. As a natural bioenhancer, piperine, which is from black pepper, is expected to increase the bioavailability of curcumin and then enhance its beneficial effects. Turmeric and curcumin are generally well tolerated with few adverse effects. Really high doses, like the kind they're using to treat COVID-19, can cause stomach upset, nausea, dizziness, or diarrhea, but those stop when a person ceases taking it, and it's not in all cases. Curcumin acts as a phytoestrogen, so it shouldn't be taken by people with hormone-sensitive conditions, breast, uterine, or ovarian cancer, endometriosis, adenomyosis, uterine fibroids, low testosterone. It can also lower testosterone. It may damage the liver in high doses, so it shouldn't be taken by people with liver conditions. And it slows blood clotting, so it should not be used by people with clotting disorders or on blood thinners or right before surgery. Ginger, Gingiber officinale, is an anti-inflammatory, antioxidant, and antiviral. This is due to compounds it contains, including gingerol, gingiberine, and chagol. A study found that ginger reduces symptoms of acute respiratory distress. Intriguingly, water-based extract of ginger are still effective at managing respiratory symptoms, rather than requiring isolation of its compounds. That's actually fairly rare. I just want to note here that a lot of the time, herbalists have this idea that, a study found that this isolated plant chemical, this phytochemical, had this effect on the body and it treated this or it cured that, and they go, so I can just tell my clients to eat a lot of that thing. But oftentimes you could eat enough of something that your stomach exploded and you wouldn't get enough of that phytochemical to have the effects that were observed in a clinical setting. This is interesting that, like with cranberry juice, it can just be the juice. This is, you can make a hot water infusion of ginger and have it help manage respiratory symptoms, not needing it to be isolated gingiberine or chagol or gingerol. It is effective as a hot water infusion to reduce coughing, and just inhalation of the steam of ginger water infusions is effective at reducing coughing. One study found that people who took ginger supplements orally at a dosage of 1.5 milligrams twice per day while hospitalized with COVID-19 reduced the length of their stay. Ginger is generally well tolerated with few adverse reactions. It can cause nausea in high doses, though it often relieves nausea at lower doses. It is contraindicated for people with clotting disorders, as it may thin the blood, or people who are already on blood thinners should not take it. It should not be used before surgery. It can also lower blood sugar, so it should be taken with caution by those with low blood sugar who are already on blood sugar-affecting medications. Garlic has been found effective at reducing the frequency, duration, and severity of upper respiratory tract infections. It enhances immune response and shows antiviral activity, likely due to a compound in it called allicin. Garlic is generally well tolerated. It can cause side effects such as bad breath, heartburn, gas, and diarrhea. High doses can lower blood pressure, so it should be used cautiously with people with low blood pressure or on blood pressure affecting medications. High doses can also lower blood sugar, so it should be used cautiously by those who have hypoglycemia or who are on blood sugar affecting medications. High doses may also thin the blood, so it should not be combined with blood thinners or used by people with difficulties that reduce their ability to form blood clots. High doses of garlic should be ceased 2 weeks before any surgery because it can cause bleeding complications. Onions have been found to have antioxidant, anti-inflammatory, immunomodulatory, and antiviral properties. Multiple studies and reviews have confirmed that they reduce symptoms of respiratory tract infections and improve lung function. Onions contain quercetin and fructans, which help fight respiratory tract infections and improve outcomes during and after infection. They also smooth and relax the trachea and bronchial cells. A controlled, randomized, and double-blind study conducted with a mixture of garlic and onion extract concentrate demonstrated significant protective effect on respiratory diseases of infectious origin in elderly healthy volunteers and residential care facilities. There was an overall decrease in the number of events of infectious respiratory diseases, as well as in the number of associated symptoms and their duration. The researchers concluded that regular consumption of an allium extract improves the immunity of elderly volunteers and that it could be used as a preventative against the most common infectious respiratory diseases. The active product that they used is called AllioCare, which contains concentrated onion extract, 86 milligrams, standardized in organosulfur compounds derived from popin, 10 milligrams per capsule, and garlic powder, 14 milligrams, all combined with a microcrystalline cellulose, which is like 450 milligrams. So it's actually a fairly small amount of onion extract and garlic extract that someone would take in a day. And they wouldn't necessarily have to use this brand. This is just the brand that was used in the study. Okay, and now I'm out of slides. Let me just check my notes really quick and see if that is the end of the food section. One sec.
Yeah, garlic and onions.
Garlic and onions. So I got all the way through the food section, but then as we get into the herbs section, I don't have slides. To be fair to me, I'm recovering from surgery, and this was supposed to be someone else's job this week.
Questions on the food?
Yes, questions on the food section before we get into the herb section. Questions, comments, concerns? Nothing?
You might have mentioned this, and I might have missed it. With the flavonoids, what about their heat sensitivity? Because I'm thinking, like, I don't think any of us are going to eat raw onion,
No.
at least willingly. So those flavonoids, do they stay intact with
Yes.
heat?
In many cases they do. There are some flavonoids that are damaged by heat. There are some that are actually made more bioavailable by heat. But even cooked onions, you're still going to get quercetin out of them. Fermented onions, pickled onions, you're still going to get quercetin out of them. Each individual flavonoid you can look up whether or not it's going to be impacted by cooking, but the point is to just eat. To eat a diverse diet full of fruits and vegetables and supplement when necessary, but hopefully not have to supplement very much. Supplements are very expensive, and some of them aren't very bioavailable. I did try to address the ones that were being found to be helpful. I will note, I will recommend someone's work. There is a person whose work I really like. She wrote a book called Nutrivore, and she has an online website, which is the Nutrivore website, and she goes into how to get every micronutrient and macronutrient you need through what you eat in really detailed form. But I will note that, of course, it's expensive to do that. Whether you're trying to supplement or whether you're trying to get it out of your diet, our lives and our incomes of the average Americans do not make this easy. So hence focusing on the ones that are the most effective, like curcumin, vitamin C, quercetin. Okay. Any other questions before we move into the relevant plant actions? Okay. As we've already noted, every plant has a combination of unique actions on the body. Some plants appear in more than one category as they affect the body in more than one way. These categories are a dramatic oversimplification as plants have a variety of different actions combining to make each one unique. What is a desired action on the body for one person can be a deadly action on the body for someone else. We already went into that, but even immunostimulant plants, which are in common use against respiratory conditions that suppress the immune system or which take advantage of an already depressed immune system, are contraindicated for people who have autoimmune conditions or who are on immunomodulating drugs already. The role of anti-inflammatories. Any kind of respiratory ailment likely involves multiple kinds of inflammation, a cellular reaction caused by foreign and non-foreign agents. In the case of respiratory conditions, the foreign agents can be irritants, pollen, dust, smoke, bacteria, or viruses. The non-foreign agents may be human cells, such as macrophages, lymphocytes, neutrophils, etc. Plant-based materials that help the body reduce inflammation are known as anti-inflammatories. Inflammation can be desirable. It's part of the body's response to infection and injury. Sometimes reducing inflammation makes an injury or infection worse. Other times, treating the inflammation as a symptom ignores underlying conditions. However, in cases where inflammation is deleterious, there are medicines that address that in various ways. It should be noted that anti-inflammatories act by reducing the cellular inflammatory response rather than relieving the macro-level symptoms of inflammation, as herbs with other actions, e.g. demulcent herbs, do. Types of anti-inflammatory herbs include the salicylate-containing anti-inflammatory herbs. Salicylates are a widely distributed group of simple phenolics and include compounds such as salicin, methyl salicylate, and salicylic acid, with salicin being the first identified compound in this class and was used to create the well-known pharmaceutical drug called aspirin. Salicylates are one of the oldest and most commonly used non-steroidal anti-inflammatory drugs and have been in common use in medicinal herbalism since before we had written language. In the body, salicin is converted into salicylic acid and is used primarily as an analgesic, anti-inflammatory, and anti-rheumatic agent. They are most useful for musculoskeletal inflammation, but it is also a key ingredient in various other anti-inflammatories, like anti-inflammatories for the skin. In general, the action of salicylates are anti-inflammatory, analgesic, antipyretic, antiseptic. Salicylic acid can upset the stomach, although this is less common when using a hot water infusion of a salicylic-containing plant than it is from taking an aspirin. In fact, Filipendula ulmaria, which is rich in salicylates, can even be used to staunch mild stomach hemorrhage. In high doses, salicylic acid has an ototoxic effect. I'm going to skim over that. Not super relevant for this right now. Salicylism, which is an acute overdose of salicylates, can produce toxicity symptoms ranging from mild nausea, vomiting, abdominal pain, lethargy, tinnitus, and dizziness depending on the dose consumed. The plants that are most commonly considered salicylate-containing anti-inflammatories and which are in use for the treatment of respiratory ailments include plants in the willow family and wintergreen. Plants containing steroid precursors. Steroids were originally plant-derived. Plants that contain secondary metabolites that act like steroids are referred to now as steroid precursors, even though originally they were just called steroids. Some steroid precursors have an anti-inflammatory effect due to being metabolized by the body into steroidal molecules. These are best used to treat autoimmune-related inflammation, less relevant in the treatment of respiratory ailments, but one of them which is licorice root, which we'll be getting into more in a minute. Terpene and terpenoid-rich plants. Terpenes and terpenoids are two categories of secondary metabolites that have anti-inflammatory actions. Depending on the specific terpene or terpenoid, they may do so by acting on receptors in neurotransmitters, acting as serotonin uptake inhibitors, similar to antidepressants like Prozac, enhancing norepinephrine activity, comparable to antidepressants like Elavil, increasing dopamine activity, and augmenting the GABA, an inhibitory neurotransmitter that counters glutamate, an excitatory neurotransmitter. Some can also ease the digestive system or the respiratory system or skin inflammation. Plants that are considered terpene or terpenoid-rich anti-inflammatories and which are used in treatment for respiratory ailments include German chamomile, rosemary, and calendula. Some plants are anti-inflammatory because they suppress inflammatory pathways by reducing pro-inflammatory cytokines. These can be especially efficacious against COVID-19 related inflammation. Plants that are commonly considered cytokine-reducing anti-inflammatories include turmeric, ginger, rosemary, garlic, and aconite. I do not recommend aconite, but there's some really fascinating research coming out about aconite's effect on cytokines. We as herbalists would not be using aconite for that. We can't get the isolated compound out of it, and it's not worth killing someone. I shall try and save you from death by giving you aconite and killing you. The role of antimicrobials. An antimicrobial is a substance that kills or inhibits the growth of microorganisms like bacteria, viruses, fungi, and parasites. Some plant-based medicines are antimicrobial, helping the body fight against infection. Most antimicrobials need to be used with caution, as they can also kill the body's natural microbes, which are essential for the body to function in a normal and healthy fashion. There are many, many ways that botanical antimicrobials destroy microbes. Some do it by interfering with a pathogen's metabolism. Some directly kill some microbes they come in contact with. Some block the adhesion of a pathogen to a body system. Some antimicrobials work best against fungal microbes, some against viruses, some against parasites, and some against bacteria, and thus they are subdivided. Each system of the body has plants that are particularly suited to it, some of which are antimicrobial. Natural and herbal antimicrobials that are in use for the treatment of respiratory ailments include tea tree, cranberry juice, garlic, thyme, golden seal, osha, echinacea, myrrh, and eucalyptus. The role of antioxidants. Antioxidants are substances that inhibit oxidation, a chemical reaction that produces free radicals, which can lead to the degradation of organic compounds. Antioxidants are linked to improved respiratory health by protecting the lungs from oxidative stress and inflammation caused by infections. Higher dietary intake is associated with a lower likelihood of respiratory ailments, and deficiencies are linked with increased respiratory problems. Some antioxidants reduce the severity and duration of active infections, that should say. However, that often requires very high doses. More research is needed to establish the efficacy and safety of high doses of plant-based medicines for reducing the severity and duration of an active infection, rather than preventing one from happening or preventing it from becoming severe in advance of that. Natural and herbal antioxidants that are in use in the treatment of respiratory ailments include vitamin C, vitamin E, clove, cinnamon, turmeric, ginger, thyme, fennel, chamomile, mint, lemon balm, and marshmallow, which is Althea officinalis. I do have all the scientific names in here. For the really common ones, I'm skipping it, but they are in here. The role of analgesics. An analgesic is a pain reliever. Analgesics are often distinct from anesthetics, which temporarily reduce and or eliminate sensation. However, analgesia and anesthesia have some neurophysiological overlap, and so an herb may be both analgesic and anesthetic. In the case of respiratory ailments, analgesics may be topical. They're applied to the throat, for example, in the form of a syrup, or ingested to address overall body ache, such as when white willow, feverfew, or valerian is used to reduce overall body ache in a person with influenza. Plants used as analgesic in the treatment of respiratory conditions include echinacea, ulmus fulva, marshmallow, calendula, willow, aconite, feverfew, and valerian. The role of anticatarrhals. Catarrh is the inflammation of the mucous membrane. Anticatarrhal plants assist the body in removing excess mucus. This can be in the sinuses, but also in other parts of the body, although most of the time the term is used for botanical products that help the body remove excess mucus to relieve the symptoms of ear, nose, and throat conditions, such as allergies and respiratory tract infections. The body needs mucus. It's part of the immune system's response to microbes. However, an excess of too thick of mucus can lead to blockages and to infections. Some anticatarrhal herbs thin mucus so that it is less viscous and can more easily be expelled via sneezing, coughing, etc. Some others directly reduce inflammation of the mucous membranes, allowing mucus to pass through more easily. Others cause the body to produce less mucus overall. Botanicals that cause the body to produce less mucus should be used sparingly, as they can have a detrimental drying effect or damage the immune system's ability to defend itself from microbes. They also tend not to be very targeted. So you end up with having dry mucous membranes everywhere rather than just in your sinuses, and I'm sure you can all guess why that might not be great. Some anticatarrhals work via astringent action, generally from tannins. Some work via anti-inflammatory actions that target specific systems of the body, and others work via being volatile oil-rich. Others work via containing the secondary metabolites of flavones and flavonoids. Natural anticatarrhals in use for the treatment of respiratory ailments include golden seal, goldenrod, plantain, and elderberry. The role of antipyretics. An antipyretic is a substance that reduces fever, generally by causing the hypothalamus to override the prostaglandin-induced increase in temperature. This needs to be used with caution, as fever is again part of the body's natural immune response to infection. Natural and herbal febrifuges and antipyretics used in the treatment of respiratory ailments include salicylates and feverfew, Tennessee parthenium. The role of antispasmodics, also called spasmolytics. Antispasmodics prevent or ease spasm or cramps in the muscles of the body. Many of these plants are also nervines and carminatives, which reduce physical and physiological tension. Some antispasmodics reduce all muscle spasm through the body, while others specifically target body systems or even specific organs. Most antispasmodics affect the autonomic nervous system rather than the central nervous system, though there are exceptions that do affect both. In the case of respiratory ailments, the desired effect is to reduce spasmodic coughing. Natural and herbal antispasmodics that are in use for treating respiratory ailments include chamomile, ginger, passion flower, and datura, specifically datura stramonium, which is used in the treatment of asthmatic spasm, but not so much anymore. The role of demulcents. Demulcent herbs soothe and protect irritated and or inflamed tissues, both internally and externally. However, most topical demulcents are referred to as emollients. Most emulsients are rich in primary metabolite carbohydrate mucilages, which are made up of complex polysaccharide molecules. These become slick and soothing when in contact with moisture. Some demulcents, however, have a soothing effect on mucous membranes that they don't come in direct contact with, such as in the urinary tract or the lungs, where digestion of the plant matter causes secondary metabolites to enter the bloodstream and act as a soothing anti-inflammatory agent on those tissues via a mechanism that is not yet well understood. Some demulcents work best for specific systems of the body, such as the gastrointestinal system, the reproductive system, the excretory system, etc. For respiratory ailments, demulcents are used to soothe irritated and inflamed tissues of the lungs and the throat. The use of demulcents internally may impact the rate of drug absorption by forming a semi-permeable coating over mucous membranes, delaying gastric emptying and or binding with intestinal contents. Caution should be used when combining demulcent plants with allopathic drugs. Plants that act as demulcents for the use of in use for treatment of respiratory ailments include marshmallow, licorice, calendula, and plantain. The role of expectorants. Expectorants facilitate or accelerate the removal of secretions, mostly mucus, from the respiratory system. Most affect the bronchial secretions from the bronchi and the tracheae. Expectorants fall into several broad categories. There's stimulating expectorants, which actually irritate the bronchioles and cause a person to cough. Most stimulating expectorants contain alkaloids, saponins, or volatile oils, but not all alkaloids, saponins, or volatile oils are expectorants. Stimulating expectorants are often emetics at high doses, which means that they make you vomit. They affect the reflex action on the lining of the gastrointestinal system, so be careful with these. These include, in treatment of respiratory ailments, elecampane, licorice, bloodroot, hyssop, and lobelia. We're really only going to look at licorice root today because I don't recommend any of the others for respiratory viruses. Some expectorants are thinning expectorants. These help liquefy viscous sputum so that it can be cleared by coughing. Herbal thinning expectorants for respiratory ailments include garlic, mint, wild cherry, mullein, and linden. We already looked at garlic. We're going to look at mullein. We're probably going to touch on mint, although it's not as effective as it was once thought to be. Relaxing expectorants actually soothe bronchial spasms. These often contain mucilages and volatile oils that act to relax the respiratory system, which loosens mucus and soothes an irritated cough. These include coltsfoot, licorice, marshmallow, plantain, mullein, and fenugreek. The role of immunostimulants. Immunostimulants are substances that stimulate the immune system. They may do this by a variety of means. There are two broad categories of immunostimulants. Specific immunostimulants provide antigenic action in the immune response, such as vaccines. Non-specific immunostimulants act to augment immune response outside of antigenic specificity. I support both of these. I think that you should go get your vaccines and then, if appropriate, make use of natural and herbal immunostimulants. Natural and herbal immunostimulants in use in treatment for respiratory ailments include echinacea, and thuya, and garlic. There's more here, but those are the ones that we're really going to talk about. Curative treatment. The role of antivirals and virucidals. Antiviral substances prevent, relieve, and or treat viral infections. Some antivirals target specific viruses, while others are broad spectrum, and they target a wide range of viruses. Antivirals are one kind of antimicrobial, which includes antibiotic, antibacterial, antifungal, and antiparasitic substances. So all antivirals are antimicrobials, but not all antimicrobials are antivirals. Antiviral is not actually synonymous with virucidal, even though I see them used interchangeably, which A virucidal is not one that treats or prevents viral infections, but one that specifically deactivates or destroys virus particles inside or outside of the body. We are actually going to be talking today about a virucidal herb that, when sprayed into the environment, kills the virus in the air. Which is really cool. Please note that many phytochemicals that have an effective antiviral activity in the human body need to be isolated and given in clinical doses via allopathic treatment, but there are some exceptions to this. Natural and herbal antivirals that are in use in treatment for respiratory ailments include a whole page here that I have, but I will go ahead and list selenium, echinacea, garlic, ginger, thyme, chamomile, burdock, eucalyptus, licorice, elderberry, garlic, and then just say there's a whole bunch more that I decided not to get into. It is beyond the scope of this class to address every single one of the numerous antiviral plant species in detail. What phytochemicals are causing the antiviral activity, how they were tested and demonstrated to have that activity, what the limits of the activity are, etc. However, there is a great deal of evidence that the plants listed here contain compounds with activity against viral respiratory illnesses. The clinical efficacy of those listed is quite broad, with many having been studied against a wide range of viruses and demonstrating good antiviral effects. Now, that was in allopathic clinical settings at very high doses. Specific plants and herbs. Now we're going to get into ones that the average herbalist would have access to. And I actually did get this not only with a full bibliography, but with full inline citations. Eventually there will be full inline citations for this entire document, but I did get this section. If you're in there, full inline citations. Echinacea angustifolia and Echinacea purpurea are immune modulating plants commonly in use for prevention and treatment of respiratory infections. Its active compounds, including alkamides, polysaccharides, and glycoproteins, enhance the body's immune response. A meta-analysis of 9 studies found that Echinacea purpurea was effective in reducing the duration of treatment, the incidence of episodes, and antibiotic usage for upper respiratory tract infections and ear infections of the middle ear in children. Children often develop middle ear infections after having had an upper respiratory tract infection, as a secondary bacterial infection while their immune system is compromised. And it turned out that using Echinacea purpurea as part of the treatment for the virus often prevented development of secondary middle ear infections that would have required antibiotics. Multiple studies have found that Echinacea reduces the severity and duration of acute upper respiratory tract infections in adults as well. Prevention of upper respiratory tract infections with Echinacea extracts has been found more clinically effective in children than adults, but adults show more reduced symptoms of active infection when taking Echinacea extract than children do. One study found, in addition, that high doses of Echinacea purpurea preparation made from fresh herbs and roots at a doses of 2,400 milligrams to 4,000 milligrams extract per day significantly reduced COVID-19 infection rates. Another study on Echinacea found that high doses of Echinoforce, which is an extract that is 2,400 milligrams daily, for 4 months significantly reduced COVID-19 infection rates and symptom severity in active infections. Another study administered the same dose of the same extract to children who were aged between 4 and 12, so 1,200 milligrams a day of Echinoforce for 4 months, and found significant reductions in enveloped viruses, COVID-19 and influenza, lower symptoms, and reduced viral loads in nasal secretions. It reduced viral secretion in nasal secretions by 98.5%, which is absurd. Echinacea should not be taken by people with allergies to the Asteraceae family, which is the daisy family, such as ragweed, chamomile, or chrysanthemums. It should not be taken by people with autoimmune conditions that cause an overactive immune system or by those on immunosuppressants. It should be used with caution by those who are on medications broken down in the liver, as it may change how those medications are broken down. And it should not be used by people on warfarin, as it can interfere with that medication and cause clots. Licorice root, Glycyrrhiza glabra, contains glycyrrhizin, which has an anti-inflammatory and antiviral property. It is used to soothe sore throats and reduce coughs, and is a good demulcent and expectorant. Licorice root has been found in clinical studies to improve immune system response to both viral and bacterial lung infections, inhibit virus growth, produce anti-inflammatory activity, and inactivate some viruses. It has demonstrated its effectiveness in many studies for inhibiting airway constriction, hyperreactivity, remodeling and inflammation in the airway, although I will note that that was primarily in the treatment of asthma, and there's some question as to whether that would be cross-applicable for things like rhinovirus, COVID-19. It's been theorized that it's cross-applicable because what it's reducing is the inflammation in the airway and the hyperreactivity of the airway, but it hasn't been tested. In vitro studies have found that glycyrrhizin, the primary active ingredient of the licorice root, inhibits replication of SARS-CoV-2, but further human trials are needed. The upper limit of intake of glycyrrhizin is 100 milligrams per day, which can be found in about 60 to 70 grams of licorice root. Clinical trials are using a range of 0.015 to 0.229 milligrams per kilograms of body weight per day. One study found no undesirable effects at 2,000 milligrams per kilogram of body weight on mice, but I personally think that that really needs to be confirmed in clinical trials before you went up to that kind of dose. Most people tolerate licorice root pretty well, but some develop gastrointestinal complaints or vision complaints, which generally resolve after ceasing ingesting the plant or its extracts. More licorice intake can cause hypertension, water retention, sodium retention, hypokalemia, and suppress renin-aldosterone. Licorice can cause the body to store water, which is dangerous for those at risk of heart failure. It can also make tachycardia, which is rapid heart rate, worse, so shouldn't be taken by people with that condition. It also acts as a phytoestrogen, so people who are attempting to reduce estrogen in their body or who have hormone-sensitive conditions, breast, uterine, ovarian cancer, endometriosis, adenomyosis, uterine fibroids, low testosterone, should not take licorice root. Also, pause me if at any point you have a question or anything. I'm just blowing through this. Eucalyptus is a potent anti-inflammatory, decongestant, and antimicrobial. The primary active compound, eucalyptol, also called cineol, which is what I'm probably going to refer to it as because that's what it's been renamed, breaks down mucus and facilitates easy breathing. One study found that cineol improved symptoms, found that 200 milligrams of cineol given in capsule form improved symptoms of patients with asthma and COPD, and reduced steroid dependence. This likely has cross-applicability to lung issues caused by respiratory tract infections, but that needs further testing. Several studies have evaluated cineol in silico against SARS-CoV-2, and it demonstrates significant antiviral effects, but again, that needs to be further tested in vitro, animal, and human studies. The pure essential oil of Eucalyptus polybractea diffused in a nebulizer for 15 seconds at an oil concentration of 125 microgram per liter of air in a chamber completely inactivated influenza A in the air. Saturated oil vapor was slightly less effective at a rate of 86% elimination of the virus after a day of exposure. However, both aerosolized and oil vapor of Eucalyptus polybractea can be used to disinfect air and kill influenza in the air. Another study found that Eucalyptus globulus essential oil in vapor form resulted in a 94% reduction of virus after 10 minutes of exposure to 250 micrograms of oil vapor. The authors concluded that 10 minutes of exposure to steam-diluted eucalyptus essential oil in a dilution of 1 to 60 was able to inhibit viral activity in the air and on surfaces that it landed on. So basically, putting essential oil of eucalyptus in something like a diffuser could sterilize a room, but there's some danger with that. Eucalyptus is poisonous. Taking only 3.5 milliliters of the oil, less than 1 teaspoon, can be fatal. It can cause nausea, vomiting, diarrhea, stomach pain, dizziness, muscle weakness, feelings of suffocation, drowsiness, seizures, coma, organ failure, and death. It is unsafe to apply undiluted eucalyptus oil to the skin or inhale undiluted eucalyptus oil. The isolate of cineol can be ingested as a supplement. It lowers blood sugar, so should not be used by people with low blood sugar or who on blood sugar affecting medications. It may affect how medications are processed in the liver, so people on medications processed in the liver should check for contraindications. Eucalyptus oil is unsafe for most pets, particularly dogs and cats. Exposure from skin contact, ingestion, and inhalation of vapors to cineole can cause major health issues, including respiratory distress, tremors, drooling, staggering, seizures, and even collapse. A person should check with their veterinarian if they have an animal other than a dog or a cat, but should assume that it is unsafe to have eucalyptus oil around any pet until it is confirmed as safe. It is also unsafe to use eucalyptus oil as a topical application or as vaporized, aerosolized, or steam-diluted inhalant for children under 2 years of age. Children under 10 years of age may be safe, but it would be best to check with their pediatrician first. Thyme, Thymus vulgaris, is an antimicrobial, antispasmodic, anti-inflammatory, and an effective expectorant due to its active compounds thymol and carvacrol. Thyme essential oil has been tested in vitro studies and has shown positive effects for immune boosting of lung cells, inhibiting viruses, bacteria, and fungi, and fighting inflammation, but further animal and human testing is needed. Thyme can increase a chemical in the body called acetylcholine. This can decrease the effects of anticholinergic drugs and have an additive effect on acetylcholine levels if someone is already taking medications that increase them. That's generally medications for glaucoma or Alzheimer's disease. Thyme is also a phytoestrogen, so it shouldn't be taken by people with hormone-sensitive conditions, as we've covered so far, and it can lower testosterone. It also slows blood clotting, so it should not be used by people who have clotting disorders or who are on blood thinners or taken before surgery. Marshmallow root, Althea officinalis, is a calming mucilaginous plant, the root of which can be processed to coat and soothe mucous membranes. However, it is only beneficial for dry coughs and sore throats, and it's very contraindicated for wet coughs. Therefore, it should not be used for respiratory tract infection that has caused a wet, mucousy cough. It can be used for irritating dry coughs, which are often observed in COVID-19. I don't know if any of you have ever had that COVID-19 often causes that really dry, irritating cough. That's when you would use something like marshmallow root. Whereas I've had influenza that just had that horrible, wet, goopy cough. Don't use marshmallow root in that particular case.
Ooh, what about pneumonia?
Thank you. Marshmallow root is contraindicated for pneumonia. Yes, it reduces cough, but it also keeps all that mucus in place, and you want to cough that out if you have pneumonia. It's super contraindicated for walking pneumonia or double pneumonia. Yeah. As Ian has found out the hard way. In a German study, 822 participants ingested marshmallow root extract lozenges or used topical marshmallow root syrup for 7 days to relieve throat irritation and dry coughing. Most people reported that either product relieved their symptoms within 10 minutes. Another study performed in vitro found that marshmallow root mucilage protected human immune cells from oxidative damage and inflammation and protected inflamed mucosa, allowing for faster regeneration of the tissues. But that's in vitro. We need to have a human trial. Marshmallow root is generally well tolerated. However, it does make a protective layer on the stomach, should not be taken at the same time as medication, as it can slow down digestion and processing of medication. To avoid this, a person needs to space marshmallow root ingestion apart from taking oral medication by at least 1 hour. Don't take it at the same time as your pills. Marshmallow root may also decrease blood sugar, increasing the risk of hypoglycemia. It also slows blood clotting, so should not be used by people with clotting disorders or who are on blood thinners or right before surgery. Elderberry. This is the one I always see people talking about. It is a potent immune-boosting anti-inflammatory and antioxidant. Elderberry, Sambucus nigra, has been found in multiple studies to clinically reduce respiratory symptoms in patients with influenza and rhinovirus. It was more effective against influenza than rhinovirus, but no adverse effects other than complaints of the taste of elderberry syrup were reported in any of the studies that found that it was effective. Like, people just didn't like what it tasted like. Elderberry extract was found to be more effective than elderflower-based preparations. Standardized black elderberry extract has been found to significantly shorten symptoms of respiratory tract infections. It is unsafe to consume elder leaves or stems and unripe or uncooked elderberries. Raw and or unripe fruit can cause nausea, vomiting, and severe diarrhea. Elderberry syrup is also a laxative and a diuretic, so it should be taken with caution by people on laxative and diuretic medications or who suffer from certain gastrointestinal disorders. It is contraindicated to take elderberry syrup if you have Crohn's disease, IBS, IBD, ulcerative colitis. People need to be careful to stay hydrated when taking elderberry syrup. It can also cause nausea. Elderberry boosts the immune system, so should not be used by those who are on immunomodulating medications, immunosuppressants, or who have an overactive immune system already. Mulin, Verbescum thapsus, has traditionally been used as an anti-inflammatory expectorant. It's also an antitussive, which means it relieves coughs, and causes mucilage that soothes irritated mucosa as a demulcent. Mulin contains ursolic acid, which has been identified as inhibiting COVID-19. It also contains apigenin, luteolin, and quercetin, all of which also inhibit COVID-19 and other respiratory viruses. Mulin has been found as effective as oseltamivir, which is Tamiflu, with lower risks of complication and adverse effects. It has also been found comparable to diclofenac as an anti-inflammatory for cytokine reduction and to reduce pain from COVID-19 infection. Mulin has demonstrated antimicrobial effects, with aqueous extracts being the most effective in clinical tests. This is very strange. An aqueous extract is just a fluid extract, like a hot water infusion. To have that be more effective than like certain isolated compounds given in capsule form is really kind of wild. Anyway, at this time, unfortunately, contraindications of Mulin have not been well established. So you would look at the fact that it increases mucus on tissues, that it is a demulcent, and you would say, okay, so if someone has a wet cough, we probably don't want to use Mulin. You would look at the fact that it contains quercetin, and you would go, okay, so I need to look at the contraindications of quercetin and say, that's how I'm going to look at this. Oh. Willow. Different salic species and the isolated compounds salicylic acid and salicin have been traditionally used to treat rheumatic diseases, body pain, toothache, headache, menstrual cramps. They are analgesic, anti-inflammatory, antioxidant, anti-cancer, cytotoxic, anti-diabetic, antimicrobial, anti-obesity, and even have some neuroprotective and hepatoprotective activities. Salic's hot water extracts are antiviral in vitro studies against both enveloped and non-enveloped viruses, but human and animal trials are needed. Salicylic acid acted effectively against SARS-CoV-2 in different animal and human-derived cell lines and in precision-cut patient-derived lung slices. So it's likely that it would decrease viral loads in human trials, but those human trials haven't occurred yet. Like, they're getting set up. We're going to eventually have an answer on whether salicylic acid is effective against COVID-19 once it's already in the lungs, but we don't have those answers yet. Willow is primarily used in traditional medicine to treat the fever and pain of respiratory tract infections, but it will be interesting to follow its progress in the treatment of the active infections as well. Willow bark infusions are unsafe for infants and children because it can cause Reye syndrome, a rare but serious condition that can develop in children and adolescents after taking aspirin during a viral infection such as influenza or chickenpox. Willow bark might increase the risk of bleeding in people with bleeding disorders. It slows blood clotting, so should not be combined with blood thinners or used by people with clotting disorders. People should stop ingesting willow bark at least 2 weeks before any surgery, and people who are sensitive to aspirin, so people with asthma, stomach ulcers, diabetes, gout, hemophilia, etc., kidney and liver disease, should avoid using willow bark. What doesn't work or may not be safe? Vicks Vapor Rub. Vapor rubs such as Vicks, containing camphor, menthol, and eucalyptus oil, are a common treatment for respiratory tract infections. They are applied to the neck and chest. One large randomized controlled study found that it is unsafe and causes harm that outweighs its benefits. It did not alleviate runny nose, it did not alleviate cough frequency, it did not alleviate cough severity, and had adverse effects, including burning sensations, rashes, and inflammation. It is especially unsafe if applied directly under the nose, which is unfortunately extremely common. How many of you had parents that insisted on Vicks Vapor Rub? Anybody? It does not work. Clinical studies have found it doesn't work. It's actually detrimental. It keeps the chest wet. It causes skin irritation. So unfortunately, no, Vicks Vapor Rub is not indicated for our communities.
Especially directly under the nose.
Especially directly under the nose. Peppermint doesn't work, and this one blew my mind when I learned this. Inhaled peppermint essential oil has been found to make people feel as though they are breathing better, but it does not actually clinically improve breathing. In a randomized double-blind trial, peppermint was compared to a placebo as a treatment for upper respiratory tract infection symptoms. People reported that they felt a significant decrease in their symptoms 20 minutes after administration, especially if they had more symptoms. However, there was no statistical difference between the recovery rates of those who took peppermint and those who didn't. Direct application of even diluted peppermint essential oil to the nasal area or chest of infants and children is also unsafe, as it can cause laryngeal and bronchial spasms. Inhalation of menthol can cause laryngoconstriction. Inhaled menthol must be avoided in newborns as it is dangerous to them. Peppermint oil is also dangerous to pets and should not be ingested, applied topically, or used near them, not even in vapor, aerosolized, or steam inhalation form, as it can cause serious health issues, including respiratory problems, lethargy, muscle tremors, and organ damage. This one always gets me. Peppermint makes you feel better, like you think it helps, but clinically it doesn't. Any clinical observations have found it does not improve the actual physiological symptoms of the illness. Okay. That is what I wanted to, my family is a tiger balm family, but we used it for achy muscles and growing pains, and we're all martial artists, so we all use tiger balm. Okay. There are some recipes and dosages given in the notes, including for one that was found to be extremely effective, which was the quercetin, vitamin C, and bromelain that we mentioned. Quercetin is generally well tolerated. It did not induce any adverse effects administered either orally or intravenously at doses of up to 1 gram per day and at 10.8 milligrams per kilogram of body weight. At high doses, quercetin can cause some side effects, including nausea, vomiting, diarrhea, abdominal pain, headaches, and a tingling sensation in the limbs, along with other discomforts. But that regimen that we covered for quercetin, vitamin C, and bromelain has been found very, very effective. Fresh parsley, raw wild rocket, and oranges has also been found effective against respiratory tract infection. Using 300 grams of fresh parsley, 300 grams of raw rocket, and 420 grams of oranges provided 1 gram of flavonoids sufficient for the protection and treatment of SARS-CoV-2 infection, COVID-19, specifically the more virulent one. This regimen is still under investigation. It needs further human trials, but it shows a lot of promise. Just taking quercetin, 500 milligrams per day of quercetin, has been demonstrated to have prophylactic activity against COVID-19 infection, and 1,000 milligrams per day of quercetin has been demonstrated to have clinical efficacy during active infection as a treatment. Chizikit for children, one randomized double-blind placebo-controlled study provided 430 children aged 1 to 5 years old an herbal mixture or placebo for 12 weeks during the winter. The children who were given the herbal preparation were given Chizikit, which contains 50 milligrams of echinacea, 50 milligrams of propolis, and 10 milligrams of vitamin C. That group had significant reduction of illness episodes, 138 versus 308, a 55% reduction. Number of episodes per child, 50% reduction, and number of days with a fever, 62% reduction compared to the children who were not given the Chizikit. The total number of days that they were ill was reduced, and the duration of individual illnesses was reduced. Adverse reactions were very rare, very mild, and stopped as soon as the supplement was ceased. We talked about the steam distillation of eucalyptus and what you should or should not use it around. For inhalation, you can also just add 12 drops of eucalyptus essential oil to 150 milliliters of boiling water, and have that misting through your house if you don't have a steam diffuser. But again, don't do that if you have pets, and don't do it around infants. Okay, there are some other recipes that I'll probably end up adding in here for like elderberry cough syrup over the next couple of days. As I said, I had surgery, but we got through most of what I wanted to cover, and most of you stuck around. Cheers! We get through some pretty dense classes around here.
Yes.
Does anyone have any questions, comments, etc. while we are still recording? And I will turn off the recording and ask again. Okay, turning off the recording to ask without it going. I will note before I turn off the recording that our next class is on Saturday. It is in person and also hybrid streaming through Zoom, and it will be covering boundary setting and de-escalation of angry and disturbed individuals. So that will be on Saturday at Ruma's Hub in downtown Raleigh. I believe it starts at 11 a.m. and a link will be posted just like was posted today to our Discord, to Ruma's Slack, to Instagram, and we're considering making an email list for people to say, hey, will you email me the Zoom links when you have a class? But we haven't determined if we're doing that or not. Anyway, that one is taking place Saturday. A recording will be made of it, and that will also go up on YouTube and Patreon. It's in the free section of our Patreon, which is under Crisis Preparedness on patreon.com/Sanctum of the Craft. Now I'm going to turn off the recording.